Florida's Blood Centers, Orlando Health, and the American Heart Association are joining forces for the American Heart Association's Go Red for Women initiative. The red dress has become a symbol of women's heart health, and we want you to know the heart disease prevention tips as well as you know your dress size. Heart disease is the leading cause of death among men and women in America. It kills more women every year than all types of cancer combined. But few women actually know their risk. Sure, factors such as age, race, and family history play a role, but there are steps you can take to avoid being a statistic. The American Heart Association says it can be as easy as following the Simple 7. Get active, eat better, lose weight, stop smoking, control cholesterol, manage blood pressure, and control sugar intake. That may sound like a lot, but the Simple 7 is just that, simple.
Getting more physical activity does not have to be strenuous. Just walking briskly for 30 minutes 5 days a week will greatly reduce your risk of heart disease.
We all know we should eat healthy, but what does that really mean?
To get the nutrients you need, choose food like vegetables, fruits, fiber-rich whole grain breads and cereals, and fat-free or low-fat dairy products.
More than 2/3 of American adults are overweight, and 1/3 of the population is obese. Eating better and getting regular exercise are the best ways to lose weight. If you're a smoker, stop. The effects of smoking may take years to show up, but will cause plaque buildup in the arteries, heart disease, lung cancer, as well as chronic obstructive pulmonary disease, which includes emphysema. Yet smoking is the #1 preventable cause of disease and death in the United States. Cholesterol can be a killer when it comes to heart health. Cholesterol is a waxy, fat-like substance produced in the liver. In fact, your liver and your body cells make up about 75% of the cholesterol in your blood. But the other 25% comes from the foods you eat. Too much cholesterol can block the arteries, causing them to deliver less blood to your body, leading to heart damage and even failure. High blood pressure is the single most significant risk factor when it comes to heart disease.
High blood pressure, also known as hypertension, means that the blood running through your arteries flows with too much force and puts pressure on your arteries, stretching them past their healthy limit and causing microscopic tears.
A healthy blood pressure reading is about 120/80. Uncontrolled high blood pressure is sometimes called the silent killer because it has no symptoms. That's why it's important to know your numbers. Eating better, exercising, and avoiding tobacco can greatly reduce your risk of high blood pressure. And finally, the last of the Simple 7 is reducing your blood sugar. Most of the food we eat is turned into glucose, or blood sugar, that our bodies use for energy.
Your body makes a hormone called insulin that acts as a carrier to take your food energy into your cells. When your body stops making insulin, or the insulin stops doing its job, your energy supply and blood sugars are no longer stable and can lead to serious health problems like diabetes.
Over time, high levels of blood sugar can damage your heart, kidneys, eyes, and nerves. In fact, most people with diabetes die from some form of heart or blood vessel disease. What can you do? Reduce consumption of simple sugars that are found in candy, soda, and sugary desserts. Get regular physical activity. Moderate, intensive aerobic physical activity directly helps your body respond to insulin. Take medications or insulin if it's prescribed for you. The good news is that by reducing your blood sugar, you can slow the progression of long-term complications. By following these Simple 7 steps, we will be on our way to reducing the number of deaths caused by heart disease.